diagnosed with horizontal canal. What you're going to see is I'm going to have her lie down, and she's already going to be in the first position of the treatment. Now, if you are assessing for horizontal canal, let's say you treated the posterior canal, and now you're going back to check the right horizontal canal, you can start in this side-lying lateral body position here. If I were to see the nystagmus start to beat horizontal here, I will go immediately into the first move of the treatment. That's the one time that you really don't need to wait. If you see horizontal nystagmus versus a rotary torsional. Yeah, no torsion. So this is basically just, there's going to start off with just a goof-on maneuver here. Again, let's pretend as if I lied her down and she was positive in the sideline test. And now we're here in the first position of the treatment. So now what's going to happen is if we're talking about her left side, I am going to do a Caissoni maneuver toward the left side. But what it also really is it's like an Appiani maneuver for the right side. So I'm going to let the nystagmus fatigue and wait an additional minute. At least I think. Did I pause it? I don't think so. Oh gosh. It's kind of like, I like this video because it's kind of like AIB's like this heavenly, you know, it's all white light around. Yeah. And again, looking for nystagmus here. Now, her range of motion, we come back to this again, is wonderful. It's not going to be this way for patients, so I'm going to show you, when I do it with Stephen, on, again, ways that you can cheat using the torso and the shoulders. Nystagmus, let's say it's stopped, it's fatigued, I've waited an additional minute. Now I'm down, I've got the 30 degrees flexion, and she's basically, if you need to, again, if the range of motion isn't there, just go totally prone with the patient here. So remember, you know, talking back to, it's all about head position. So if you need to go all the way on to almost the forearms, that's fine here. If they don't have the range of motion to come here, which almost no one does.
But she's not 30 degrees there, she's flat.
She's got about 30 degrees flexion. All we're going to do, you can think of this technique as basically just a dump, back up, dump, back up. So she's rolled the body to the other side. All I'm prepping her to do is another set of Appiani Caissoni for the opposite side. And again, really, this is something we came up with by doing however many. We've got, you know, we're training students all the time, so there's always migrations. So we just, by virtue of how many of these we have to do, we came out, there's got to be a better way than diagnosing the side and sitting them up. Okay, let's just sort of work through this as like a workshop type of deal. If we try this and we came out with this horizontal hybrid maneuver, again, the publications they're not there right now, but try it. So when we break out, you can try the Appiani Caissoni. If some of you want to walk through the barbecue roll, that's fine. But I really encourage, we've gotten